Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. Welcome to another episode of Healthy Desert, Healthy You. My guest today is Seham Saba, who is a licensed marriage and family therapist, registered psychological associate, and head of mental health services at the Riverside Latino Commission. She is also dedicated to providing culturally responsive care and really trying to grow mental health professionals in the Valley. I'm especially excited because Seham is also going to participate on September 10th in the Healthy Desert, Healthy Youth Summit at the Omni Rancho Las Palmas and Rancho Mirage. She's going to be participating on a panel that's titled Early Intervention Matters, Advancing Youth Mental Health Through Prevention and Community-Based Supports. Welcome, Seham.
Thank you, Will. Thank you for having me.
I'm so happy that you're here. First, for our audience who may not be familiar with the Riverside Latino Commission, tell us a little bit about that, your mission.
Yeah, we're a nonprofit organization in the Coachella Valley, and our mission is to provide programs and access to mental health and substance abuse services for anybody in the community. We have been in the desert for lots of years, since 1993, and we have been providing services to everyone pretty much in the Coachella Valley that needs the services.
Excellent. So how long have you been with the commission?
I've been with them since 2014, so I'm going on my 13th year.
Oh, wow.
Yeah.
Congratulations.
Thank you.
So you must really enjoy your work.
I love it.
Tell me about the clients that you see there, just demographically. What are we talking about?
Yeah, we service a diverse population. We see all ages. So from the little ones that are yet not in school, all the way to adults and families. We see people with different cultures as well. You know, I know that the Latino Commission, sometimes the message they think is, oh, it's Latino Commission, it's only for Hispanic or Latino population. But no, we see anybody, different cultural backgrounds, socioeconomic status, and insure as well. So we provide services pretty much to anybody and everybody throughout the Coachella Valley, all the way to Blythe.
Oh, wow. So I mentioned in the introduction that you are very much an advocate for culturally responsive care. What does that mean to you?
Yeah, that's a good question. I think that for me, culturally responsive care is being able to get the help in the language that you feel more comfortable with someone that will understand your culture. I think that is very important. And at the Latino Commission, we try doing that. We try that especially we notice that a big part of the community that reaches out for our help are Hispanic or Latino that prefer Spanish language. So we try to really have, instead of a translator, that sometimes is, the message is being lost, right? The emotional part. We try to make sure that they have a bilingual therapist that would be able to understand.
Okay. So you've been there more than a decade. Have you noticed any difference in how clients who come to you are open to care, open to receiving care? Has that changed at all?
Yeah, I think that it goes in waves. There is sometimes that we see clients more open, and then we see returning clients that are actually very excited of being back in therapy, in substance use treatment, and all other of our services. But we also see that sometimes, depending on what's going on in the community, it can also impact their ability to seek those services. And we see some of them not want it, or like they have lost trust on the community organization. So we see both.
So because you mentioned that a significant number of your clients are from Latino or Latino descent.
Yeah.
And we hear so much about and read about, and many have seen the impact or seen the presence of ICE in the Valley. Can you talk about how that has impacted behavioral health just among the people that you've seen?
Sure. From a behavioral perspective, we see impacting the families, the households significantly. We're seeing more people seeking services due to severe anxiety, separation anxiety in children. We see that they're losing their employment and insurance as well. So those kind of things are impacting them a lot. So we're seeing an increase in anxiety and depression due to separation or due to the fear of separation. Also in children, sometimes children, they don't understand what's going on, but they can see the stress in the household. They can see, okay, there is some fear going on, behavioral changes in the household, routine changes. So we're seeing children also feeling a lot of fear and anxiety. They don't want to go to school now that the school is starting again. So their social isolation has been increasing for sure.
All right. And to give our audience a sense of just the impact in terms of what you do, what would you say were the major challenges your clients or patients brought to you before the increased ICE presence?
I think that if you look at it in the mental health perspective, right, before the presence of ICE in our community, we're already dealing with the aftermath of the pandemic. And we were trying to come out of social isolation, becoming more comfortable and, being part of the society again. And we were kind of recovering and going through that wave. And anxiety and depression were getting a little bit better, more communication. And then we struggle now with, ICE being in the community. And it's kind of like we're going through another wave again of anxiety increasing, depression increasing, social isolation, hopelessness.
So because the panel that you're going to be participating on really talks about youth and mental health services for youth, what are some of the, in addition to ICE, what are some of the challenges that our youth are facing?
Our youth are facing a lot of challenges, definitely. One of the things that we see, other than depression and anxiety, what we see across the whole community, it's social media. I think social media is a big factor for our youth. They don't have the ability to process what they see, and they are very impressionable. So there's like comparisons, it's affecting their self-esteem, their body image. They have a very difficult time distinguishing of what's real, what's not. We know that we have AI, so that's also impacting them. So we see that. We see substance use at a very early age now, unfortunately. Then the family conflicts that they're going, the separation for like immigration purposes or other types of separation, violence in the home. Sometimes a lot of the youth that come are being exposed to either violence or traumatic events. So we see that as well.
For a long time, there's been a lot of discussion around the negative impacts of social media on young women, but is it across the board now as a young men as well?
Absolutely, it's across. Males are equally at risk of being exposed to social media content that can impact them. Absolutely.
So what should a parent or an adult family member, what should they be looking out for to recognize that this is more than teen angst, that this could be a more serious issue to address?
Yeah, sometimes that I try telling the parents is, you know your child better than anybody else. We know that, developing and, being a teenager, right, comes with a lot of emotional changes, behavioral changes, but when to reach for help will be the moment when you see something that is not typical for your child, not for the neighbor child, but for your child specifically. So if, let's say, Johnny all of a sudden used to love soccer, all of a sudden he's like, I don't want to see soccer, I don't want nothing to do with soccer, and you're seeing like that change, that's a big change, isolating, that's when you need to reach out for help. Okay. Don't wait until we have a crisis to reach out for help, because a lot of the things that we do too is prevention. We want to get it when it's to the point that we can prevent it to become a crisis.
Right. And so what should they do?
At that point, you see those resources. I wouldn't jump into fixing and trying to give advice or understand the situation. I will be more of like a non-judgmental part of like, I see that you're struggling. I want to get you some support. You don't have to talk to me as a parent if you don't want to. I have kids too, so I know that sometimes the parent's like, no, you won't understand me. But there is people that can hear you and can help you and give you the skills that you need. They can call us, they can call other community-based organizations. Usually we provide same-day appointments. If you have a big concern, if your child has been acting differently, you don't have to wait for an appointment months, right? Because then a lot of things can happen in months, right? If you call us, you walk into our clinic, you would get seen that same day.
So where do you have clinics?
So right now we have a clinic in India. That's our main mental health clinic. That's in Monroe Street. And that's our main mental health clinic. But we also have therapists in the Coachella Valley Unified School District, where we have therapists pretty much in every school.
That's
so
excellent.
Then we're seeing the clients and the students right there.
Right. That's fantastic.
Yeah.
So I mentioned early on that you, like the Desert Healthcare District and Foundation, you're pretty passionate about growing the mental health provider, quantity of them in the Valley. What do you think needs to happen in order to recruit or retain professionals?
Look, I used to think that sometimes it was only a financial thing, that we needed more um, competitive pay for the clinicians, for the substance abuse counselors. But as I'm looking at it more and more, it's not just a financial thing. Obviously, yes, we need more competitive pay to be able to offer them, but we also need them to know what Coachella Valley can offer. That from if we are able to maybe get them when they are in high school, right? Providing education about the opportunities of becoming a mental health professional. They are already in love with the Coachella Valley. They are here. They don't have to think, oh, I finished high school, I need to move out, right? No, you can stay here. So if they would understand more of like the community that they're helping with, they're connected. I think that we should be able to make and form our own workforce of behavioral health providers here. And obviously, like this healthcare district, they are a great supporter for us in regards to our plans and ideas and our envision for the Coachella Valley. But I think that that is the main thing, making sure that we're taking care of them the same way we take care of our clients, making sure that we're taking care of our clinicians and staff as well, where they are not burning out because their caseloads are huge, right? So being able to listen to them as well.
Okay. So let's talk about the great things about the Valley.
Yes.
Because before we started the podcast, we were talking about how long we've been in the Valley.
Yeah.
And you've been here 20 years.
Yes.
So what would you say to a young mental health care professional that we might want to recruit about? Because we have a reputation still of being a retirement community, retirement valley, that there's not really a lot here for younger people.
Yeah.
What would you say is the appeal?
I come from a city that was the opposite of the Coachella Valley, where it was crowded and noisy. And I think in the past 20 years, the biggest thing that I gained in the Coachella Valley was peace and calmness. And it's very fulfilling to be able to give to the community that really appreciates when you're giving something to them. And that's something that, pretty much has my whole heart. And I wouldn't move out just because I see when you're providing a service, the gratitude behind that and the impact that we're making. So what I would say to a young person thinking whether to come to the Coachella Valley or stay in the Coachella Valley would be that there is a lot of opportunities and opportunities to grow. My plan was never to stay. Right? I was coming for college and I fell in love and I stayed, right? So I think that giving it a chance to grow on you, right? Because yes, I understand it's called a retirement community, but as years go by, I've seen it grow where we're seeing more youth here and more opportunities to go to school here. So definitely, I think that we need to go into the schools at the high school level and start giving that education of like all the opportunities that Coachella Valley has.
So what about in terms of young professionals who want to start a family? You mentioned that you have children.
Yes.
Is that also a great benefit of being in the Valley?
Absolutely. I think other than the heat, right? Everything else, I feel safe. I have 3 children, amazing boys, and I'm raising them here because it feels very safe. It feels very safe. They get to be kids here. And I know that sometimes we see the news and unfortunately we all see very difficult news to process, but I wish there will be more places like, for example, your podcast where we're showing good things in the community, not just the bad things that happen, because there's a lot of good things that happen here.
Absolutely.
Yeah.
It's a really great community.
Yeah.
So the summit,
Yes.
I know you're going to be bringing your knowledge and expertise, but I'm curious, what are you most looking forward to?
Yeah. I'm really looking forward having the conversation about how to be able to increase the workforce, how to be able to support our youth. Because I believe a lot in prevention. And I'm not saying that, oh, don't bring them once you're in a crisis. Of course, we have to, but we want to catch things early as much as we can. And I think that this summit will open the door to have those conversations about prevention, how to support our youth. So then as they become adults, they're healthy adults. Yeah.
I love that so much. What is the best way that our residents can support Riverside Latino Commission?
Definitely different ways. I think one of the main things will be share with their families and friends about the work we do, where we located. If they know a family member or a friend that have shared with them struggles, stress, anxiety, that would encourage them to come to our offices, to walk in, to have a talk with a therapist, right, with substance abuse counselors. That is one way, I think. The other thing is talking more about mental health. The more we're able to talk about mental health and normalize that we all have mental health, right, then we're going to break that stigma that we have in the community. And obviously following our social media so we can share our content and we're able to, spread the word as well.
And what is your website?
Our website is www.latinocommission.com.
Okay. Is there anything I haven't asked you that you would like to share with our audience?
I think that the main thing would be that to remind them that they're not alone, that there is not just Latino Commission, but so many different community-based organizations ready to support them. That I know sometimes it's difficult to ask for help, but, walk in, come to our clinic. We'll provide you the resources to how to navigate the healthcare system. We'll provide you with the services. If we don't provide a certain service, we'll connect you to one, because we want to make sure that it feels like you don't have to go through 3-4 places before you find the help. Come to us. We'll get you the help that you need.
Okay. That's a really great point, because we do talk a lot about we don't have enough providers, but we do have some really amazing organizations here.
Absolutely.
And the Latino Commission is one of the best.
Thank you.
So thank you for being here.
No, thank you, Will, for inviting me.
Thank you for the work you're doing as well.
Thanks.
There we have it. So Seham Saba is going to be at the 3rd Annual Healthy Desert Healthy Youth Summit, September 10, 2026 at the Omni Rancho Las Palmas Resort. Please come out and join us.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.